Major depressive disorder, or MDD, is the most common psychiatric disorder. In 2017, the World Health Organization announced that depression was the leading cause of ill health and disability worldwide, with at least 300 million people living with depression at the time. Now, a complex world offers multiple opportunities for depression to take hold, so we've invited Dr. Paulo in to discuss this challenge with us. Paulo, welcome. Good to have you back for a brand new season. Now, Paulo, how is MDD diagnosed?
It is a very detailed process. So there are a number of criteria, first of all. So the symptoms must cause significant distress or impair functioning in social situations at work or at home. Moreover, they must not be due to the intake of a substance or to another disease, such as cancer or thyroid conditions. They must not be attributable to another psychiatric condition, such as a type of schizophrenia or bipolar mood disorder.
Okay.
So once these criteria have been met, then there are a number of possible symptoms. There are 9, there's a list of 9 symptoms, 5 of which must be present for a period of 2 weeks. Okay, and they must, of course, cause significant dysfunction.
Right.
Two of these 9 that must be present are depressed mood, all day or most of the day, and also a loss of interest or the ability to enjoy pleasure in activities that were pleasurable before.
Okay.
So those 2 must be present. The others include things such as insomnia or hypersomnia, all right, weight loss. It includes things such as the loss of energy, reduced physical activity, thoughts of death or suicide, difficulty concentrating, also inappropriate feelings of guilt or worthlessness.
Right.
All right. But it's very important that the viewers note that you must not self-diagnose.
Right, okay. And also, I mean, obviously by the name it implies major depressive disorder.
Yes.
So it's not the early stages of depression that we're talking about here. It's further advanced.
No, it's not you feeling sad because your soccer team lost the game.
Yeah, absolutely. So now, in terms of the causes of major depressive disorder, what gets us to the point of it being major? What causes that?
From a scientific point of view, there are genetic predisposition factors. Okay, and then there is the interaction from between the environment and a whole lot of biological systems. One of the prime hypotheses, which is no longer the prime hypothesis, but it has been there for a long time, is that the production of monoamines, which are the neurotransmitters, serotonin and dopamine, that is affected, which means that is not there to support your mood or your desire to even feel better about whatever the problem may be. Then there is also neurodegeneration of the system between the pituitary and the hypothalamus in the brain and the adrenal gland, and then there are various inflammatory processes. However, these are not, in my personal opinion, really causes. They are more triggering factors and factors that contribute to the deterioration of the condition. I believe the real causes have to do with your self-assessment, your identity. Who are you? What are you here for? And also it has to do with your perspective of your circumstances. You know, if you take 10 people and they all face the same circumstance, you're likely to get 10 different reactions.
Yes.
So those are the very important things. Who are you and your perspective of what is happening. If your perspective is distorted, well, then you are on your way to possibly feeling depressed.
Right. So it's an interaction as well. As you say, there are those physiological factors which trigger, but ultimately the psychological state that you're in is what may lead you down this road.
The stress, what we call stress.
Right. So Dr. Paulo, we read in an article published in November 2020 in the scientific journal Frontiers in Psychiatry, and that details the potential benefits of curcumin in depression. So please just remind us, curcumin, we've spoken about it before, where it's from, what it is, and how it might help.
All right, so curcumin is from turmeric. Turmeric is a spice. It's been used in Ayurvedic and Chinese medicine for thousands of years. Over the last 50 years, there's been ample research, and they've identified the substances called curcuminoids, of which curcumin is the most active one. This research has shown that it is effective in many conditions, including cardiovascular conditions, neurodegeneration, as well as cancer and diabetes, and it has an antidepressant activity.
Okay, so it's interesting. It's a very natural product that is going to have pretty strong impact on your health. So we've previously discussed curcumin's positive effect on inflammation. How would the effect or the impact on inflammation be helping us with a depressive disorder or condition?
All right, so chronic stress will lead to chronic inflammation. There are a number of mechanisms. For example, in the central nervous system, there are immune cells called microglia. Okay, so they react to environmental stresses by producing pro-inflammatory substance, by initiating an inflammatory process. They produce cytokines of different types. Then there is a molecular structure known as an inflammasome. And what it does, it translates psychological stress into inflammatory processes again. All right. So usually under depressive states, there is a lot of stress, so to speak, and this chronic stress will activate both the microglia, the production of cytokines, as well as activating the inflammasomes, and therefore leading to the the increase of inflammation, especially in the central nervous system, which includes the brain, obviously.
Okay.
Also, we know that if we measure inflammatory markers in the blood of patients that have depressive symptoms, we find that they are elevated.
Okay. So then how, in practicality, does curcumin impact or help with this kind of inflammation that's causing this major depressive disorder?
Yeah, it does in a number of ways. So animal studies and human clinical trials have shown that, for example, curcumin is able to reduce the number of pro-inflammatory substances with names such as interleukin-1 beta and tumor necrosis factor alpha. It can decrease them, especially in the prefrontal area of the brain, which is the area of the brain that modulates emotions.
Yes, and personality and all those things. Yeah.
Then in terms of the inflammasomes, for example, one of the main inflammasomes that is activated in depression is known as NLRP3. And curcumin has been shown to reduce the activation of this inflammasome.
Okay, interesting. It's so fascinating because when you think depression, I mean, as me, I've never thought inflammation. It's just, it doesn't connect, but it's wonderfully interesting to figure out.
It's a major initiator and contributor to it.
Right. Now, Dr. Paulo, reduced levels of neurotransmitters like serotonin are what's often thought to be a major cause of depression. But now we also understand that glutamate is playing a role in that whole system. Tell us about how that works and then how curcumin might interact with that.
Glutamate is a neurotransmitter. It's an excitatory neurotransmitter. It also has a job to do in the gut, but we're going to leave that out now. So what it does in the central nervous system in the brain is that it has one of its jobs is to strengthen the synapses. The synapses are the points of contact between neurons. Information is exchanged. And it also increases their neuroplasticity, their ability to adapt to different needs and circumstances. However, if there is too much glutamate present, then the receptors for glutamate are overactivated. And it creates what we call excitotoxicity, all right? And that can happen due to chronic stress. Under conditions of chronic stress, which happen in depression, all right, another set of cells called glia that are supposed to remove excess glutamate from the surrounding tissues do not work properly. So there is excess glutamate. And that causes excess activation, excitotoxicity, which leads to the damage of synapses and the death of neurons.
Right, right.
And that, of course, that is how glutamate would be a factor in depression. Research has shown that curcumin can reduce the liberation of glutamate more effectively than fluoxetine, which is an antidepressant drug.
One of the most common antidepressant drugs.
Yeah, one of the oldest as well, yes.
Right. So Dr. Paulo, how else might curcumin be aiding in depressive or with depressive conditions for help?
It does it through a number of different mechanisms. We spoke earlier of the axis between the brain and the adrenal glands. In that axis, curcumin is able to reduce the levels of cortisol that are produced by the adrenal glands as a stress response mechanism, and it can also cause the adrenal gland to recover its normal size.
Right.
And then we have the area of insulin sensitivity. So where insulin sensitivity is reduced, as with diabetics, the uptake of neurotransmitters such as dopamine and serotonin is impacted negatively. And we know that curcumin can improve insulin sensitivity, thereby improving depression and its symptoms.
Okay. Now, Paulo, a big thing with curcumin is often the discussion around bioavailability, which is not always so great. So in our Real Health Medicine cabinet this week, we've put biocurcumin with BCM95. What makes this particular product a good option, specifically when it comes to bioavailability?
Yes, that's very important. In the early trials, before extracts were available, they used up to 12 grams a day,
Sure.
which was 12,000 milligrams, a huge amount of curcumin. And of course that brought a whole lot of side effects, especially gastric side effects. There are a number of 95% standardized extracts in the market at the moment. The specific one, known as BCM95, so that's the type of curcumin inside the product Bio-Curcumin. Okay? This specific one is a patented 95% extract where they mix curcumin with AR-turmerone, which is one of the oils in the plant.
Okay.
Okay, and they've had over 80 clinical trials. It has been shown to be 700% more bioavailable than normal 95% extract. So that means one of these capsules is with 7 of a standard 95% extract, and it is active for 8 hours.
Okay.
That has been shown in research.
Right.
So from all these factors, it's an excellent source of curcumin.
Great. And Paulo, with something like this, I mean, how often should you be taking it to see results? And also, how long, once you start taking something like this, would you take to see results?
See, that's very difficult because, as I normally say, treatments must be personalized.
Right.
There is no one size fits all. We must take into account what other supplements or medication the patient is on. So the healthcare practitioners that each one is worth need to work out this entire combination and decide whether 1 capsule a day is sufficient, 2 capsules. This specific product, at the dose per capsule, one can go up to 8 capsules a day, but that depends on all these factors that need to be studied properly, unfortunately.
And I suppose also the difference.
There is no single recipe.
Yes, and the difference between maintenance and therapeutic doses and all of that as well.
Yes.
In terms of contraindications and also people who shouldn't be using this product, are there particular things to look out for?
Yeah, so generally pregnant women shouldn't use it. People on blood thinning medication should not use it. Anyone who's got gallstones, it is known that even turmeric, even the spice, but of course curcumin, because it comes from turmeric, can stimulate the gallbladder
interesting.
to squeeze
Yes.
its contents out. And if there are gallstones, the squeezing will cause incredible pain.
Okay.
So from that point of view, one should keep away.
Right. And where can we find this product?
I believe it's available in health shops and pharmacies.
Wonderful. Thank you so much. As always, lovely to
Pleasure.
have you with us.
Thank you.